So, hi everyone. Let's look at this important topic for your upcoming exam. So, which of the following is true about Klinefelter syndrome? So, option A says webbed neck, which is incorrect, which is what you see with Turner's. Polydactyly is also incorrect. Two bar bodies is also incorrect. They would have only one bar body. So, the correct answer is C, gynecomastia and long legs. So when we talk about Klinefelter syndrome, it is actually the most common sex chromosome abnormality with an incidence of 1 in 1000. Now, what you have to know is that in Klinefelter syndrome, these boys at puberty will have an incomplete development. Instead of having testicular enlargement, they will have a small testes because it undergoes fibrosis. So the testosterone production from the testes is low, as well as spermatogenesis is defective. So they will have azoospermia and infertility. Now, since the testosterone levels are low, what would happen to LH and FSH levels? They would rise because of no feedback inhibition. They will have less facial hair, less pubic and axillary hair, right? And as I said earlier, they are going to have taller height as compared to their counterparts, and the legs actually outgrow the arms, so they will have long legs as well. They're classically likely to be less muscular and more likely to have osteoporosis as well as arthritis. Now, what you need to also remember is that these boys are more likely to have 3 of these malignancies that I'm going to talk about. So they have a higher risk of developing breast cancer. They also have a higher risk of developing extragonadal germ cell tumors and a higher risk of developing non-Hodgkin's lymphoma. Also, certain, autoimmune disease risk is increased, which includes Hashimoto's thyroiditis, type 1 diabetes mellitus. Apart from that, they're higher risk of developing rheumatoid arthritis as well as SLE. These boys are also likely to have Parkinson's-like tremors. And please remember that their IQ is low. So they will also have learning disabilities. Yes. And when we talk about their cardiovascular risk, yes, there is a higher risk of developing ischemic heart disease as well as mitral valve prolapse. So these are some of the important things that you must know about Klinefelters for your upcoming exam.